All right, let's get into our first topic then. And should workers on long-term sick leave be forced back to work? Now, according to the Office for Budget Responsibility, poor health is the biggest threat to our public finances as it puts huge pressure on the NHS and welfare services. Now, a record 2.8 million people are off work due to long-term illness. It says that this is the key reason why taxes are going up, but we're not seeing any improvement in public services. So is it time to cut the benefits burden and get people back to work? Get your calls in for this one now. I'd love to hear from you. I'll start with you, Peter. What's your thoughts?
The benefits bill for people who are out of work is £100 billion a year. It's a staggeringly large amount of money, and it's fundamentally unsustainable. Work is good for the soul, but some people have fallen into the trap where a life on benefits is more beneficial financially than it would be going to work. That cannot be right. I wouldn't say force people back to work. I would say encourage, cajole, persuade, convince. But that's going to need experts in the field to reach out to these people, but we need to get as many people as we can back into work.
Do you think that's a fair analysis of why people are off work, Nelufar, or maybe COVID had something to do with it?
I didn't hear any analysis of why people are being out of work in that, Peter. So I'll listen in on that when you kind of talk about it. But to build on what you're saying, it is a good idea to get people back into work. It is indefatigable, indisputable that people, if you work, you have a better outlook in life, you have better mental health and so on and so forth. But we've had 15 years of austerity in this country. Austerity has made people sick. The NHS being the way that it is, people are taking much, much longer and getting much, much sicker before they seek help in the first place. There are a myriad of reasons why there are more sick people. We've just had a global pandemic that's left thousands upon thousands of people in ill health, presumably for the rest of their life. So it's easy to say let's get people back into work. And I don't disagree with it on the surface. But the idea of benefits Britain being kind of held back because of people who are finding it easier to be on benefits rather than work, I don't buy that in the slightest. If you want people to go back to work, which we all do, you have to make it, you don't have to cajole them or convince them. You have to make it so that going back to work is beneficial for them. Austerity's made people sick, Storm. Don't be misguided about that. The country is on its knees and people are taking longer and longer off work because they need to.
Well, it's, the point that I was trying to make is you seem to think that when people were off working from home, etc., during COVID, they quite liked that lifestyle and sort of got used to it. But I wonder whether actually we've got people still suffering with long-term COVID symptoms now after the pandemic. Our waiting lists on the NHS are extraordinarily long, so that would probably be adding to the long-term sickness. And I wonder whether maybe those are the things we should be focusing on rather than reducing the benefits bill.
All of that may be right, but we're only really going to know when there's people knocking on the door and saying, I need to come in, I need to speak to you, we need to assess your situation, assess your health, assess your finances, assess your capabilities, assess any opportunities for training that you might need, and get people back to work in a holistic, rounded kind of approach.
Rather than just a GP.
Yeah, it can't be done by kind of the GP only. It needs to have some joined up thinking, an element of compassion, but also a carrot and a stick approach.
I mean, NHS mental health services are difficult to get hold of. We all know that. But with mental health issues, quite a lot of them can improve when self-esteem improves. Part of that is going to work. So maybe this would help. I know a lot of people that are off at the moment on long-term sick leave are off because of mental health issues. Perhaps this sort of policy would help those individuals.
Let me give you a good comparison, Storm, for why that kind of thinking it could be problematic, right? Germany, the powerhouse of Europe, right? The place we go to when we want an example of a working country who have high levels of productivity, high levels of employment. Today, a report released by the Krankenkasse insurance company said that Germans are taking more sick days than any other time since the pandemic. They've gone from 15 to 19 6 days. And this is the powerhouse of Europe. This is one of the healthiest economies that we have in Europe. And the reason they're doing it, one of the main reasons, is because of the mental health. Now, it's easy to say that people who have long-term mental health issues like depression, anxiety, debilitating CPTSD, whatever it might be, should get back to work because it's better for them. It's harder for the individual to do. And I don't think laying the blame at the... It kind of feels a bit like we're victim blaming here. We're saying, you're sick and that's your fault, now get to work. There has to be, it's not joined up thinking, but there has to be services provided that get people back into work. It can't just be a mantra that we wheel out when we need to.
I think we're focusing on the individuals that are often long-term sick, which is probably the natural thing to do when you're having a discussion like this. But let's focus on the businesses that employ those individuals as well. If we are forcing these people essentially back to work in an unproductive state, how fair is that on small businesses, big businesses, any employer at all?
Well, we should avoid doing that, I think, at all costs. But with regards to the mental health issues, I'm rather well positioned to talk about that because in my lifetime I've had 2 catastrophic mental health breakdowns, both of which led to hospitalisation. And the thing that was so beneficial to me to regaining the robustness of my mental health and getting back on my feet on both occasions was going back to work. Not sitting in television studios, I hasten to add. One was as a security guard.
Not doing a proper job.
One was as a security guard, OK, and facing all the challenges that brought. And then on the second occasion, a mate of mine who had a small chain of furniture stores got me back to work in one of his stores, and I was hoovering carpets, cleaning windows and selling beds and sofas. And it was absolutely crucial to me recovering my sense of well-being, a sense of having a place in the world, and generally feeling much better.
Peter?
Work is so good for the soul.
God forbid that you should have needed more time. God forbid that your illness might have taken you longer to recover. That's what the welfare state is there for. To be there for you, because you are one of the most impressive people I've met, and I've spoken to you on camera and off camera about everything you've done for this country and for your community and your family. If you had needed it, it is there for you. That's the only thing I'm saying. I'm not saying that there aren't people who abuse the system. I'm sure there are, but you know, I'm proud that there's a system there that should you have needed it for a year or 2 or 3, it would have been there for you.
On both occasions, my friends who had those businesses pretty much twisted my arm to get me back into work. And it did me the power of good.
So you think there might need to be a little nudge there? We are just talking, it would appear, about mental health issues. Obviously, there's all sorts of illnesses that could mean you're on long-term sick. We'd love to hear from you. Jean from Dorset, what's your thoughts on this? Do we need to, force is a quite hard word, really strongly encourage people back into work?
Yeah, I think we do. I mean, I am a former benefits advisor. I've seen and heard it all. The benefits system was designed to be a safety net for those who are genuinely unable to work. I can tell you it has become, for many people, a lifestyle choice.
Okay. Do you think, Jean, just in your opinion, do you think it is a conscious lifestyle choice where they have decided that this is how they want to live, or it is just they've just sort of slipped into that lifestyle and don't know how to find their way out?
No, I had people coming into my office with a list of benefits that they wanted to claim. And I have to say, my early days of being a benefits advisor, some of these people knew more than I did.
Oh.
It has 100%, I agree with Peter, it has 100% become a lifestyle choice, not for everybody.
Yeah.
Those people do deserve our support. But for so many, what incentive is there for them to go to work when they are quids in on benefits?
How do we separate those two groups, though, Jean? Because that's the truth of every policy. There's always somebody that's going to find a loophole around it. So how do we close those loopholes?
That is the difficulty. I think you need more people in position who are monitoring these people. I mean, coming into my office with a bad back, unable to work for the last 5 years or whatever, they look perfectly okay to me.
Okay.
People posting on social media, going down a zip wire on holiday in Spain, claiming that they haven't been able to walk properly for years. What it needs is money invested in investigation.
Okay, Jean, thank you very much for your call and your insight in that. Lynn from Glasgow, I believe you are off on long-term sick at the moment.
Yes, I am. I became disabled in 2021 through no fault of my own. And listening to people like their previous caller, making everybody feel as if you're on long-term sick, then you're at it.
To be fair, Lynn, she made it very clear that it wasn't everybody, but she said that there was a large proportion. So I suppose the question is, Lynn, how do we separate those individuals like yourself who are on long-term sickness benefits for good reason and those that might be slightly gaming the system? How do we, or just gaming the system, I don't know why I likened that, how do we separate those two very distinct groups?
I really don't know, because everybody seems to think that living in benefits is a life easy, which it's not, and B, that you get these sickness benefits really easily, and you don't. You've got to jump through hoops to get them. So I really don't know how people who are not genuine are actually managing to get a hold of all these benefits.
What do you think about Keir Starmer's comments that he made a couple of weeks ago now, where he said that anyone on long-term sickness benefits should be looking for work, either looking for ways to contribute to their former workplace or looking for new places to work and other things that they're able to do?
Right, if Keir Starmer can find me a job that I can do 90% from my bed because I can't get out of bed, and he can find an employer who's going to be able to say that I can phone up in the morning and say, look, I'm sorry, I'm not fit enough for work today, who's going to be putting up with that for any length of time and still being able to say that they'll give me a job, then bring it on. I'll take the job.
I was just about to suggest call centre. You've got a lovely phone voice, but I am partial to a Glaswegian accent, Lynn. But you're right. If it's your sort of on-off working, might be very difficult for an employer to deal with.
We're assuming just a couple of things. We have to be careful that we don't persecute the many for the crimes of the few. So we've got these electrifying, heated instances of people abusing the system, and we've decided we're going to blame everyone with this tar, everyone with the same brush. Secondly, benefit fraud in some cases, in some areas like incapacity benefits or wherever it might be, is in the single digits. Okay, so the fraud that's being committed in these departments, it's in the single digits. And what we want to do is, because we're so scared that a penny of the public money might be misspent or abused, we're willing to tarnish everyone with the same brush. That's not the way I think that this should be run. It's not compassion. As Lynn said, if someone can make it so that she can go to work, she's happy to do it.
I do understand that, but I think what Jean was saying, when you look at the fraud that's being committed in this area, it's very difficult because I think the idea is that we're not seeing all the fraud, and that's what Jean was trying to get at. I think so it's maybe slightly misleading there, but I don't know, and I don't think we came to any answers on that part, unfortunately. Did you want one final word in there?
Just to say, carrying out investigations into people that are doing fraud deceptions are manpower intensive and quite expensive. I've been there and done them.
Oh.
Okay, Lynn, thank you very much for your call. We're going to